Tuberculosis kills nearly 4 lakh people every year in India, but most people don't know that those who are HIV positive face a greater risk, not just of contracting TB, but also dying of the disease, because most do not show any signs of the disease till it's very late. In fact, to prevent these deaths, the WHO has now changed its treatment guidelines. Mawa Chaudhary reports.
How can a person be for 3 course during 2 years? I think there is something wrong. Either the doctor read wrongly. People living with HIV/AIDS, even though they are cured, the chest X-ray looks like they're still having TB. There's a problem of diagnosis when it comes to people living with HIV/AIDS. Unless we improve the diagnosis, this DOTS TB program is not going to work.
India's most successful program against tuberculosis is faltering badly when it comes to HIV-positive people. Most go undiagnosed till it is often very late. At the moment, anyone who is HIV-positive undergoes the same tests as those who are not. But there's a crucial difference. In people living with HIV, the virus compromises the immune system so badly that they are often asymptomatic. The body fails to generate the usual inflammatory response that indicates the presence of the bacteria, making it very hard for doctors to diagnose. So many HIV-positive people will not have fever, cough or blood in sputum. Even X-rays, a standard method to detect TB, often fails. So treatment is often delayed, which can be fatal. Doctors say they have to rely on suspicion, since it is well known that people living with HIV are usually co-infected with TB. Current diagnostic kits are outdated and unable to identify the bacteria rapidly. The only reliable test is to culture the bacteria in a laboratory, but that takes a lot of time.
The diagnoses that we have for TB are very old diagnoses. We still diagnose it as Robert Koch did it when he discovered the Mycobacterium tuberculosis, which is the microscope. It's more difficult to identify the bacteria in the sputum of the people living with HIV. What we really need is point-of-care diagnosis that can tell you yes or no, that person has active TB disease and should be started. To be faster in diagnosis, that's the main problem right now.
More than 900 people die every day of tuberculosis in India. It is also estimated that half the deaths due to AIDS-related causes is also because of TB. Many of these occur because of poor detection and delay in treatment. Governments are now being encouraged to invest more in advanced diagnostic kits as well as to start ARV treatment early in order to save millions of lives. In Vienna, with camera person M. Divakar, Mawa Chaudhary for NDTV.